Joining me now, Congresswoman Jan Schakowsky, Democrat from Illinois. Congressman, is this fight more about politics than policy?
Well, it's certainly very serious for women if the Republicans are going to try to stop access to contraceptives for all women with no copays, no matter where they work. That was the idea of this preventive service for women, a health care service, a basic health care service that 98% of Catholic women and 99% of all women in America use. And 28 states already require that there not be a total religious, that religious institutions like hospitals and universities provide this service. So for women, this is a serious battle. I hope that the Republicans will, and especially we hear a lot from men on this, will understand how important it is to the women of America.
Now, Congresswoman, you talked about the 28 states that already have it, and there are 8 states that has it without exemptions. But I think that the framing of this is a little disturbing to me. If I am a person that lives and works in an area that does not get a lot of services, and therefore I get a job that I badly need at a hospital that is run by a religious institution, don't I, as a woman, have the right to want to be covered just like someone across town that may have different options for jobs? Isn't this really about protecting people's rights that work in these facilities that are not necessarily of the religious belief or a member of that church? Isn't it their rights at stake here, not the institution's rights?
Absolutely, and thank you for that. That's right, that these women who are secretaries or nurses or orderlies or changing beds, this is their job. And they certainly deserve to have the same health care as everyone else in the country just because they work for a hospital that is sponsored by a religious organization. Absolutely, they should have that. And let's remember, Reverend Al, these are hospitals that work in the public space. They get funding from the federal government, Medicare, Medicaid kinds of funding, and they should be treating their employees like all employees. Basic health care services should be provided to them, and that minimally is access to contraception. And you know, Reverend Al, 58% of women who use a birth control pill use it not only to prevent a pregnancy, but for other reasons, other health care reasons. And so are these women going to be denied access to that basic care?
Now, you raised something that's interesting because I'm an activist and I believe in taking a stand, but you stand by what you believe, but you pay the consequences. If these institutions are getting federal money, as you say, Medicaid money, how can they then tell the government that the government must not follow the law? I want your money, government, but you must do what I say, not I must do what you say, even though I'm taking federal government money from taxpayers that may not believe in my religion.
Exactly. You know, we've already exempted 335,000 churches and houses of worship from this rule because most of the people who work there are of the same religion. But when you've got these kinds of institutions that are widely available to all kinds of employees and all kinds of users of different faiths, to impose this on those workers is really discrimination against them. This is not religious discrimination. This is not an attack on religious freedom. And you know, if you even want to go there, what about the religious freedom of women to choose for themselves? Does the religious freedom of an institution override that of an individual that is associated with that institution? The bishops seem to think so, and fortunately, the Obama administration has said no, those workers are going to get the care.
I think you made it very clear what the issues are tonight. Congresswoman Jan Schakowsky, thank you for your time.
Thank you so much.